Hey ladies, one of the main effects of the years approaching menopause is that you dry out. Not only your skin, your eyes, your hair, but even down there. The tissue becomes drier and thins out, and you might experience irritation, pain, itchiness, and even infection. And it's not just about intercourse. It's also not good because the dryness affects the microbiome balance, making you more prone to infection and odor. The tissue down there should be supple and even have some moisture. So what causes this change in these years? It's a drop in your hormones, in particular estrogen and testosterone. And how can I solve it or get relief? To address this at the root, you need to take your hormones or take supplements and eat foods that contain phytoestrogens. And there's also something you can do to increase the blood flow and energy to this area, which may also help you. And that's what I'm going to show you now. So first is breathing with the pelvic floor to build awareness to this area and get some movement and blood flow. Then 2 hip openers, as the name suggests, to open the hips and create even more flow, and the side effect of hip openers is generally feeling more grounded. Let's begin with the pelvic floor. Take a comfortable seat on the floor or at the edge of a chair and rest your hands on your knees. Take a moment to settle and relax. Feel your pelvis heavy on the earth, sinking like a clay flower pot filled with soil. Close your eyes. Breathe in to your lower belly and feel your low belly expand like a balloon. Along with this expansion is the pelvic floor expanding. And now exhale and feel your balloon retract. Your belly draws in and your pelvic floor lifts. Let's try a few more rounds. Inhale, expand the belly, the pelvic floor like a balloon. Exhale. Pelvic floor lifts. It's a very subtle movement. Belly draws in. Take 2 more rounds. Now relax your concentration. Open your eyes. We're going to try this breathing into 2 other poses. So come onto your hands and knees into a table. Place your hands beneath your shoulders, your knees hip-width distance. You can curl your toes under. So right here, inhale, expand your belly, expand that balloon. So the pelvic floor expands. And then exhale, feel your belly draw in, retracting, the pelvic floor lifting. We're going to add a subtle movement here. Inhale, expand your belly, arch your back, expand that balloon in your low pelvis so the pelvic floor expands. And then exhale, draw your belly button in, draw your pelvic floor up, and arch your back like a cat. Chin toward the chest. Inhale again. Expand the balloon. Exhale. Retract the balloon. Okay, slowly come back to center, and we'll try in one more pose in a different relationship to gravity. So come down onto your back for bridge pose. Bend your elbows like you have robot arms and gently press your elbows down. Press your back of your head into the mat and widen your chest here. Inhale, lift your pelvis. Expand that balloon in your pelvis, in your low belly. Pelvic floor expands. Exhale, the belly retracts, the pelvic floor lifts. Inhale again. And just keep that imagery of the balloon expanding from the inside and then the balloon retracting as if you're letting air out and the balloon gets smaller. Inhale one more time. Exhale. And slowly lower your pelvis to the earth. And come back up to your seat. So to help get the energy flowing there and more circulation, practice this low belly breathing, this balloon breathing. And you can try it in these couple of poses to try it with a different relationship to gravity. And at the beginning, you might just find it's a subtle sensation you feel, but stay with it. You'll develop more awareness as you practice. Thanks for joining.